Hi everyone, my name is Ina. On Instagram, I'm the Asian Allergy Mom, and I'm really excited to have this chat. We're going to talk to Dr. Kelly Cleary. She is going to help us to think about K through 12 education with food allergies. We're talking about being allergy aware. We're discussing ways to navigate food allergies in school and how we can support kids with food allergies and their parents and caregivers. This session was developed by Vindico Medical Education and FAIR with educational grant support from Genentech, a member of the Roche Group. So we are right now waiting for Dr. Kelly Cleary to join. And so while we're waiting, I wanted to tell you guys that my daughter, who is in first grade, she's allergic to peanuts, dairy, and egg. And she has her last day of school this Friday. And I'm happy to report that, fingers crossed, it's another year where she did not have an allergic reaction at school. So that's really good news. So today we're going to be asking Dr. Kelly Cleary some questions about sending our kids to school with food allergies. And we'll be taking any of your questions and hopefully we can get to some of them. Hi, everyone. So I am going to see if I can invite Dr. Cleary. Give me just a moment. She is representing FAIR. Oops. Her. Let's see if she's going to join us. Dr. Cleary, we are waiting for you. Let me see if I did that correctly.
You did. Hi.
Hi, Dr. Cleary. How are you?
I am well. How are
I'm
you?
doing so good. Thank you so much for joining
Thank you
us.
for having me. I'm excited to be here.
Me as well. So Dr. Cleary, I'm just going to quickly introduce you. Dr. Cleary is the medical director at Food Allergy Research and Education in McLean, Virginia. And we're just going to have a short Q&A session with some questions that I have prepared, but also we'll see what questions come in from the chat. And Dr. Cleary, is there anything else that you'd like to say to introduce yourself?
Just that I'm a food allergy mom too. So I have 4 kids, and one of my sons has multiple anaphylactic food allergies. So, that's kind of what drove me to work at FAIR and to be kind of working and advocating for not only the whole food allergy community, but my family as well.
Wonderful. So yeah, you have a stake in this topic for sure.
Mm-hmm.
Yes. So we're just going to get started with some of our questions. So we have to start with the basics. What are the signs and symptoms of food allergies in kids? And when should you contact a healthcare provider if we're concerned?
So the first thing, the pediatrician in me says that if you are concerned, call the pediatrician, right? There shouldn't be, I feel like parents shouldn't be afraid to reach out to their healthcare providers and say, I've got a question. So that's right off the bat. But as you know, and as everyone in the food allergy community knows, the signs and symptoms of food allergy reactions can vary. So some of those could be mild symptoms like having a single hive, a few hives on your face, maybe minor belly pain, a little bit of itching or a runny nose. But those are kind of the mild symptoms. Then they can become any, allergic reaction can go from mild to more severe, but more severe signs and symptoms are things like problems breathing, so wheezing, repetitive cough, feeling like your throat is closing, swelling of the mouth and lips. Some people will experience cardiovascular symptoms, so heart symptoms where their heart may race, or they may feel dizzy, or they may feel faint. They may even start to get like a bluish tinge. One of the symptoms that I think that sometimes goes under recognized is the gastrointestinal, so the stomach symptoms. And we often hear people who, if someone is vomiting after eating their allergen, people will be like, well, it's good. They're going to be okay. They're vomiting. But truly, severe persistent vomiting is a sign of a severe allergic reaction known as anaphylaxis and needs to be treated.
Absolutely. Thank you so much for making that clear. And just as an add-on to that question, if we notice any of these signs or symptoms, particularly like skin irritation or some minor symptoms doesn't necessarily mean it's a food allergy.
No. And food allergies, they're hard to diagnose even in the medical field. So, anyone who's been through the process of diagnosing a food allergy knows that it's not just one test that points to it and says, yes, you have a food allergy. It's really that constellation. So, it's clinical symptoms and history where someone has reacted to a certain food, from there visits the doctor and gets that skin prick and IgE, and then sometimes goes forward for that oral food challenge. But the interesting thing is that there are times, and I think as food allergy moms, sometimes that line gets a little blurred, right?
Right.
If one of my daughters yesterday, we were on a walk and she got a hive on her face. She doesn't have food allergies. So to me, I was like, you're fine. You're
Mm-hmm.
going to be fine.
Mm-hmm.
But if my son with food allergies started getting hives, my mind would start racing, right? So
Absolutely.
we still have to put that clinical scenario together, but not every one of those symptoms will mean it's a food allergy, right? So you really have to just be thinking of what else is going on, what has the child or adult eaten, and is that consistent with possibly having a reaction?
Right. And one interesting thing I learned recently was that hives can often be because of viruses and not because of a food allergy. And I think that's so important for many of our parents to know.
Yep, it's called viral urticaria. And sometimes you'll see that it doesn't even have to coexist with the virus itself. It could be after the virus.
Wow.
So if but truly in a child with food allergies, as we're always on high alert,
Yeah,
we're just thinking about what could possibly be happening. But then I always say, if you're concerned, that's what your pediatrician, your doctor is there for.
absolutely. That's great advice. Um, as both a mom and a physician, can you talk about the importance of creating a food allergy plan with your school? And that's a big question, I know.
And I'm sure you know how hard it is sometimes to do it. So I'll say it in a couple of different ways. So the first, for school, that was always, my go-to was to get that emergency care plan, bring it to the school, make sure the school understood what my son's allergies were, how to treat his allergies, and then to kind of look at what happens as a result of that, right? So if he has this symptom, maybe we go to this. But the other time to think about, and again, emergency care plans in schools are really to create awareness of your child's, condition and what they need from that. The other place that sometimes parents forget about emergency care plans are things like babysitters
Mhm.
or sports coaches.
Mhm.
I remember when my son now is 13, but when he started, organized sports and everyone was just dropping their kids off, I was sitting there waiting in the car because I felt badly, like telling his coach, here his epinephrine and here's the pack. But that's another great place to use an emergency care plan. So not just thinking about it for school, but thinking about it for outside of the home, for people who might not be as familiar with food allergy as we are.
Absolutely. And I think that's so important to give the emergency care plan to anyone who's watching over our kids. But when it comes to school, especially, I think that one thing that gets forgotten is accommodations to prevent food allergic reactions. And we can dig into that after I get through a couple more questions, but we'll come back to that if we have time. So the third question I have for you are there any new treatments that can help to prevent or manage dangerous allergic reactions at school?
So I'm not sure how old your kids are, but how old are your kids?
My daughter who has food allergies is 7, and then her older brother is 10.
Okay, so my son with food allergies is 13, and 13 years ago when he was diagnosed, I remember driving in my car, getting the call of all of his, food allergies, and just sitting there thinking, oh my goodness, like I have to just keep this child safe by avoiding all of these foods. And that's what's so amazing about where we are right now in food allergy is that I think that food allergy families finally have options. You're
Mhm.
going into your allergist, you're going into your pediatrician, and it's no longer just avoid that food. It's
Right.
having a conversation on who your child is, if you're an adult, who you are, what you would like, and really having that shared decision making. So in the past few years, we've had really great gains in food allergy. And one, the earliest that came along that the FDA approved is called Palforzia. And that is a peanut oral immunotherapy. So oral immunotherapy basically is building that tolerance by giving little doses, and then to a point where you get a tolerance. So Palforzia is for peanut, and that is, people are still widely doing oral immunotherapy, and it's becoming more popular. In February of 2024, a drug called omalizumab got approved by the FDA. And omalizumab actually was around even 20 years ago when I did my residency. I would have kids there that were on omalizumab for asthma. But in 2024, it got approved for another indication for food allergy. And what that does is it increases the threshold for the amount of food that you could eat in order to get an allergic reaction or anaphylaxis. So I look at it almost like a little bit of a safety net. Right. You're still avoiding your food, you're still carrying your epinephrine, but this is a safety net where maybe before it would have been a crumb that would have you react, but now that's a little bit more. Right. And you're working with your doctor. People do it either alone, or sometimes they'll do it side by side with OIT. But again, that's another conversation. And then the last thing that's kind of really new, and we've got new epinephrine modalities coming down the pike as well, but is the nasal epinephrine neffy. So that is, it's the same, actually, it's the same type of device. I gave a talk earlier today, so I have all my epinephrines, all just to show that I've got everybody. But this one, it's the same device as Narcan. And so this one is just inserted, and then, a needleless option. So I just feel like we're at that point that we finally have options. Yeah. And looking to the future, there's so much more hope that I really, for the first time, think, okay, I might see a time when my son doesn't have food allergies.
Absolutely. And it's so exciting. It's such an exciting time in science and in food allergy right now. Mm-hmm. And what I hear you saying is that there are many ways to build in layers of safety, yeah. Right? Omalizumab with the nasal epinephrine and OIT, things like that, which we're actually looking into this summer. So we're excited. Mm-hmm. So it's just very encouraging that there are so many options out there right now. We only have another minute or two. This went by so fast. So my last question for you is, how can we help our kids advocate for themselves? Do you have any advice for other food allergy parents on this front?
So last night I did a college chat with a couple of women who their kids are actually older than mine, but one of them said, and I thought it was just so poignant and I took it away with me, was I wish I had started earlier in teaching her son that. And I think allergy parents, moms, dads, caregivers, guardians, we are always kind of vigilant and watching out for our kids, and really their interest is always our first interest as well. And as a result, sometimes, I know I do it, I start to advocate for him, right? If we're sitting at a restaurant, he's 13, and I'll say something like, he'll have and he's allergic to peanuts, eggs, and shellfish. But really what we should start doing is doing that from as early as they can get it, right? Teaching them they have the voice to say it. Mm-hmm. And one of the best things that we could always do, and I sound like a broken record in my home, but every time he is going near the door, I say, do you have your epinephrine? I don't care which version of epinephrine you have, but do you have epinephrine? Because if he's in a situation where he has a severe reaction, I know epi first and epi fast.
Absolutely. And just to echo on that, like, my daughter is 7, but she is already such an amazing self-advocate. Like, just today, she was telling me about how a lunch aide had like dairy on her hands. She's allergic to dairy, to yogurt or cheese on her hands. And she was asking this lunch aide to open her packet for her, but she asked the teacher to wash her hands first. And so from the beginning, even when she was a baby, we would talk to her about, how we're preventing cross contact, how we're reading labels. And I feel like a lot of parents don't know that our kids are so capable of learning, even from such a young age. And that advocacy, develops and evolves, and they need new skills as they go into like teenage years and things like that. So I appreciate you telling that story about your son. Yes.
Bravo to you,
Thank
because that is no, but that really is you doing it in a way that now she's modeling it.
right.
So kudos to
Thank you
you.
so much. And we are out of time in our session, but I hope that people who are here will follow along because Dr. Clear, we will be talking to Rania, and you can find her at Black Allergy Mama. And their discussion will cover health disparities in food allergy and the importance of representation, which is a topic that's very close to my heart as well. So I just want to remind everyone that this live will be placed in my Instagram feed and posted on Vindico Medical Education's Instagram and YouTube pages. So Dr. Cleary, thank you so much, and we're really
Thank
looking forward
you.
to the rest of the
Yes,
conversations.
thanks, Ina. Have a
Thank
good
you.
night.
You as well. Good night.